Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name's Sandy. I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm. I'm a retired consultant surgeon, and throughout my career I had a particular interest in the care and treatment of cancer patients. Presently I am Chairman of the Isle of Man Anti-Cancer Association. In this podcast we want to talk about pancreatic cancer awareness.
Pancreatic cancer affects around 8 to 10 people on the island each year. Because the pancreas is situated deep within the abdomen, its early symptoms frequently go unnoticed, and as a result the disease can be quite advanced when first diagnosed. Surgical resection can also be difficult because of its proximity to vital organs and major blood vessels. At present, only 1 in 5 individuals with pancreatic cancer survive for 1 year or longer, although results are beginning to improve with newer novel treatments. Being aware of the early symptoms associated with pancreatic cancer can certainly improve outcomes.
The pancreas lies in front of our backbone and kidneys, high in the abdomen behind our stomach. It is often described as being tadpole-shaped, with a head, a body and a tail. The pancreatic duct, which runs the length of the pancreas, joins with the bile duct, which drains the liver, before emptying into the small intestine at the mouth of the tadpole. The pancreas makes pancreatic juice, which contains enzymes responsible for breaking down food so that the body can absorb it. It also makes hormones, principally insulin, which controls our blood sugar levels.
Now, there are 2 types of tumours that arise in the pancreas. Most tumours arise from the glandular tissue within the pancreas and are called adenocarcinomas. Very rarely, tumours can arise from the insulin-producing cells, and these are known as insulinomas.
What symptoms should we be aware of for pancreatic cancer? Symptoms, to some extent, depend on the type and position of the tumour in the gland. If the tumour arises in the head of the pancreas, an early symptom is jaundice, that is yellowing of the skin and whites of the eyes, with dark urine and pale stools. Remember though that jaundice can be a result of many other illnesses, such as gallstones or hepatitis, but you should arrange to see a doctor fairly urgently if you become jaundiced. Another symptom of pancreatic cancer generally is upper abdominal or back pain, which may be intermittent and worse on lying down, and is often associated with weight loss. Less common and often vague symptoms include loss of appetite, indigestion, feeling sickly or being sick, a bloated sensation after meals, change in bowel habit, difficulty in swallowing, tiredness, or developing a DVT or deep vein thrombosis without another obvious cause. Patients with carcinoma of the pancreas sometimes present as a newly diagnosed diabetic. Those who develop an insulinoma tend to present with blackouts, fainting or confusion, which is improved by eating, similar symptoms to those experienced by a diabetic who may have taken more insulin than they require.
Pancreatic cancer mainly affects people in middle age and old age, most being over 65. However, various lifestyles throughout adulthood enhances our chances of developing the disease in later life. Smoking is a main risk factor, particularly if associated with heavy alcohol intake. A diet high in processed meats, such as ham, sausages, bacon and burgers, or a diet higher in fat and sugars predispose to the development of pancreatic cancer. Other factors are obesity and being physically inactive. Having 2 or more family members with pancreatic cancer, having chronic pancreatitis or diabetes are also other risk factors.
There are a number of lifestyle changes that we can consider doing to reduce our risk of developing pancreatic cancer. Avoid or giving up smoking. Limit your alcohol intake. Eat a healthy diet with plenty of fresh fruit and vegetables, and restrict your intake of processed meats. Ensure you undertake some physical activity, and be careful about your weight. If there is a family history of pancreatic cancer, talk to your doctor about possible screening.
So let's just recap on the symptoms of pancreatic cancer. Jaundice, that is yellowing of the skin and whites of the eyes with dark urine and pale stools. Upper abdominal or back pain, which may be intermittent and worse on lying down and associated with weight loss. Other less common symptoms include loss of appetite, indigestion, nausea and vomiting, a bloated sensation after meals, change in bowel habit, tiredness or a DVT. These symptoms can be due to simple benign conditions, but it's always best to get things checked out.
For more information about pancreatic cancer, you can visit the Macmillan Cancer Information and Support Centre up at Nobles Hospital, or contact them by telephone on 650 735, or have a look at their website at macmillan.org.uk. Another good website for looking for information about pancreatic cancer is at cancerresearchuk.org. Thank you for listening.